All right, Liberty Kitty Cats, I'm here with a little special bonus show. I am with the co-founder of the Health Excellence Plus program. So one of our very first sponsors, and it is, of course, open enrollment time. For many of you out there, you are making decisions about your healthcare, have a lot to think about. So I thought I'd do this little show with Jeff to answer some questions and, explain more about our very first sponsors at Health Excellence Plus. Jeff Cantor, welcome back to the show. Are you ready to roar?
I am ready to roar and then some.
Excellent, Jeff. Now, for people that are new to this entirely, obviously we always have new listeners hopping on board, so some people might not have even heard of this program at all. So why don't we just start with the very basics. What is Health Excellence Plus, and why should people, particularly those who understand free market economics and libertarian ideas, why should people consider using this as an alternative to the standard health insurance that so many of us are forced to buy, or at least believe we're forced to buy through Obamacare?
Very good. Well, first off, to start more philosophically, the reality of insurance, it's built into kind of a giant cartel of sorts, because there's the hospital operations, the pharmaceutical companies, and typically the government in some fashion, and then the insurance companies themselves. So they're all kind of working in an interconnected way. And that's why, as a good example, there's no price transparency. People always worry, how much does this cost me per month, or what would my copay be, and never how much does that MRI cost, or how much does that surgery cost. So because of the opaqueness of the business, it's just an inherently disastrous situation. And so really the goal of what we're doing in essence is to break that logjam and give people a chance to kind of do a 180-degree about face and go in the free market direction, where we all see what the price is, and all my costs are a lot cheaper because I've not built in a bunch of excesses in there that are hidden from view, which means I can usually take advantage of the consumer. So ordinarily you're going to think, boy, I really need to get some health insurance, because what if I have a heart attack or something like that? And this is very true, but your health is a lot more broad than that. I mean, you're going to eat food and have a variety of other things. I might have a sore throat on a weekend. I might need to get a medication, and boy, I heard that they're cheaper in Canada, or any number of things that you're going to have something that may pop up that has nothing to do with ending up in the hospital because of a heart attack.
Right.
So Health Excellence Plus is really more of a comprehensive approach, because it not only takes care of any of those more catastrophic and the things that are more worrisome, but also all the everyday realities that one would encounter.
Right. Now, who exactly is this for? What is the type of person that should be looking at Health Excellence Plus? Because as you've mentioned in the past, this is not necessarily for everybody. I mean, if you have a really low income and you do get an Obamacare subsidy, it might just make sense to take that. If you're in a situation where your insurance is almost entirely covered by your employer, it probably makes sense just to take that. So this is probably more for people who don't fall into those categories, who are considering their options. So what type of person should be looking at this program?
Yeah, that's a great question. So we're not wasting everyone's time that this might not be suitable for. This is absolutely for the typical person that would be on a 1099 income, where they're working for themselves. They might be a plumber, a real estate agent, or any number of, there's, thousands of professions in America that this matches up to, where they're receiving, a pretty good amount of income, at least higher than they, like Mark was mentioning, where they would get a subsidy on the Affordable Care Act. If you're going to be paying full retail for a Blue Cross policy, $1,200 a month, and I'm going to be, let's say, just hypothetically, $600 a month. Well, that's a pretty substantial savings. So that type of a person, anybody that's paying for their insurance themselves, let's say they work somewhere, but they don't provide insurance. Well, this is going to be perfect for you to consider as well. One, again, it's going to bring you a lot more benefits and features, but also it's going to be a lot less dollars. Or, interestingly, Mark, what we're seeing a lot of late is, let's say that you, Mark, work for GM. And so you get this really fantastic price for this incredible Cadillac plan, but the minute you want to add your wife and the kids, they charge her like full retail, like 3 times what you're paying, because she's being added to your policy because she doesn't work there. She doesn't get that special inside price. So we'll do special programs just with the spouse and the kids in a lot of those types of instances. And then the only other person this really would not be appropriate for, even if you're on your own and paying for yourself, is if you have a very severe chronic illness. We're talking about 1-2% or so of the population. They're going to be kind of forced, unfortunately, to be stuck with normal health insurance.
Gotcha. Now, I want to, I don't want to beat around the bush on this stuff because I know one thing a lot of people are thinking as they're listening to this is, of course, what is this going to cost me? And I think that anybody that has shopped around for health insurance is going to be very impressed when they hear what it costs them. But if you could just do a little breakdown of what these costs, of what this plan would cost, that would be great.
Oh, yeah, fantastic. Well, I just happened to run some numbers because we were just, we're in open enrollment. So all these companies have released their pricing recently. So we were just trying to do some comparison. Now, one thing that's interesting, we did not raise our prices. So historically, we're structured and pre-planned in an intelligent enough of a way, and we're working on a nominal margin. The difference is that insurance is working on enormous markups because they've got high levels of commission. They own buildings. They have company vehicles, shareholders, and all the rest. And they're there to make profits. But, it's all well and good to make profit on your restaurant or something of that nature. But here we're talking about making profits on people's medical bills. So I said, it's like your accountant, they get paid a fee to push the numbers around in your books. Well, what's the insurance company doing beyond similarly? Just pushing a bunch of medical bills around, making sure the stuff gets, paid. Beyond that, what are they really doing?
Yeah, it's not like the doctor they're making profit on trying to help you. These people, because of our crony capitalist system, they're just making profits on pushing your bills around.
Yeah, exactly. So in our instance, that's why we're so dramatically cheaper, because on that one factor alone, we're taking it back down to where it's just like, look, we pool a bunch of money and we put a little administrative cost on top of that and a little bit of markup, and then we're all happy, and then we're really helping people. And, we get a lot more volume and all the benefits. And that's how the free market always works. I mean, if you get a good price point, you're going to get I may make a little bit less, but I've had 5 more people show up. So in the end, I actually made more money, even though on each individual transaction, I made less. Right. And so, but the other reality is having understood and having built into the program is the reality of the world, because, not that many people break their leg or have a heart attack, especially under the age of 65.
Right.
So, but they do have a greater likelihood of, bumping their head or getting an ear infection or any number of small, minuscule things that in many instances now, because they really weren't around a long time ago, you'd run to the corner urgent care center. I wouldn't think to go to my doctor maybe, or I don't even really have a doctor. And in the old days, I go to the emergency room or something like that. Well, I wouldn't do that anymore. Now you go to CVS and go to urgent care, the little clinic they got in there, the Minute Clinic. So, that's the highest likelihood of things of that nature, especially if you're a parent, you have a little kid, they get earaches and runny noses and, all this little stuff. So in our world, we include all of the tools and services that you would need to make sure that thing is taken care of, which a normal health insurance type program is only going to be good if you break your leg or have a heart attack. It's not going to really help you in most of those other instances. Right. We're even going to make sure you have all of your medical records, that you actually have your own personal vault. And what's so unique about it, in a patented way, we give you a key fob and a wallet card with a QR code that first responders can find. So they're able to see exactly what's wrong with you, so they can start treating you on the spot. Wow. Instead of just trying to get you sort of stabilized and rushed to an emergency room somewhere. So we built in all the unexpected things, but also all the absolutely I know you're going to need to do and use type things also.
I think one thing that a lot of people might think about too is, if this is something I'm sort of doing more on my own, does that mean do I have to start calling, 15 doctors to find the best prices for things? So if I want an MRI, do I have to make 20 phone calls? How does Health Excellence Plus, sort of help to alleviate any concerns that people might have of doing this sort of more quote unquote on their own?
That's a good question, because we didn't even get into that all that much, and you're absolutely right. And it's a little daunting at first blush, because instead of if I took a particular plan from XYZ company, they have a published list of doctors that I'm allowed to use that are in network. And it might be a big list, but it's still a list. In our world, you can go anywhere you want to go. So there is no such thing as they're in or out of network or in this state or in that county. So this is good as a tool to travel around the world, or just I vacation all for a month in Florida and that type of stuff. But my Ohio-based plan doesn't work down there, that type of thing. So you don't have any of those concerns. But in today's world, because pricing is much more known in certain respects, but also with that card that I was mentioning that you have on your wallet or in your keychain, there's a number on there for you as a member. So if I do need to find a better MRI or a better priced medication, everything's just a phone call away. Oh, my baby's got a sore throat. What do I do? boom, I'm talking to a live doctor right this minute. So they're kind of act as your universal triage person. So you don't have to remember about all these different elements or all the cool features you've got. You have one medical helper person that you can call one quick phone call away. And what's nice about it, because you want that key fob thing available in case I'm at an accident, well, guess what? I have that phone number I'm to call with me at all times. So it works out super, super well.
I think the big, one of the big points here is not only does this program typically cost less than almost any insurance you could buy on the free market, again, unless you have a subsidy or unless your employer is paying for it, but it's also about so much more than simply processing you like you're just some paperwork to process, which is how we're essentially treated by the standard insurance companies. Again, not because of the free market, but because of the way that crony capitalism and regulations have completely morphed the market into something it could never be on its own. Are there any other benefits you want to touch on about what Health Excellence Plus can do for people that they would get that they would just never get from just their standard insurance?
Well, one little benefit that's not so obvious initially, but the idea is having control over what happens with the market. The more you eat at a certain place, the more popular it becomes type of mentality. And how can you influence what's happening in the insurance market? You really can't. But in this instance, you really can, because if you, as an example, wanted to get an MRI in the town that I'm in the conventional way, and you were going to try to pay for it outright, utilizing insurance or however they would quote it out, regardless of what your copay would be, they're going to want to charge about $2,000 to $4,000. Wow. But in reality, there's a little boutique operation. They've got a few spots. They're typically not known to the general public because they're fairly busy off of these private relationships they have with either employers or doctors. And they'll do every one of those same MRIs, but they'll only charge $300 for it.
Gotcha.
So if I were to just utilize it as a consumer and always get that expensive one, I'm not really helping the market. If anything, I'm like the enabler of the bad activity that's taking place. But if I say, boy, I really would like to support that idea, I really want to give that $300 a place of the business all the time. I want to encourage that activity. Right. And then guess what? What I pay per month for this program, Health Excellence Plus, stays low, because if all the people that are involved go and get $3,000 MRIs every day, eventually we're going to have to raise the price we charge per month, even if we're working on a small margin. Right. So if we keep everybody steering into that 300, and it's at their discretion, no one's obligated to do it. But lo and behold, when most people that say, hey, this is my money on the line and I can either raise or lower my monthly cost, I think I'll try to keep it low. They're going to more often than not try to get that better pricing. So by utilizing this to help yourself, you're actually improving the market. Yeah. So as a libertarian thing, that's an exciting thing about what we're up to too.
Yeah, I mean, we've been working together now for maybe 4 or 5 years, and I don't think the prices have gone up once that whole time. I remember really being impressed by the prices even back then, and now they're essentially the same. I think they're exactly the same. I know you maybe have some new tiers and that kind of thing, so maybe it's not 100% exact. But point being, you could never look at real insurance, or I say real insurance, but the kind that's most approved by the government, and see it. It just rises exponentially every single year. Whereas you guys are able to keep those prices flat, and that's all because of the way you're approaching these things, of the way that you're trying to approach things by actually looking at the cost and analyzing the cost benefit of things, and not just sort of blanket giving out payments to connected hospitals, connected companies, and that sort of thing.
Yeah, look at it. The perfect analogy is the idea of college loans, because lo and behold, every time they increase the amount they're willing to loan, the tuition at the college goes up.
Right.
It's like doesn't anyone see that, like that matchup? They just rise. It's like your expenses rise to your increase. Every time I increase my income, my expenses go up. Right. I just spend more money. Well, the same thing's happening here. Every time they raise the price of insurance premiums, the cost of going to to go to the hospital and all those places goes up.
Right.
So they're like in lockstep with each other, whereas our whole goal is if you put the price out there and I'm $300 for MRIs, how much can the other people charge if everybody's really obvious about their pricing? Yourself, there's certain areas in your local town where there's like the 4 gas stations on one corner, and they're like 10 cents, 15 cents cheaper than every other gas station in town, because they're battling it out to be the one getting all the traffic at that corner coming into their store. So, that's what's really great about fostering this. What people really appreciate when you talk about hidden benefits is the idea of having that helper person. Because I really need a trusted person. And, like anything that I'm busy, I have a real life, I got a family, I got a job, I have hobbies, I want to entertain myself. I don't have time to become an expert on my insurance policy.
Right.
So if and whenever I need it, I want to just call some number and get some help. And there's none of that in any of those types of products. And so with us, it's like, we know that. So there's ways you can go in there and look at the stuff hard on paper, but everyone doesn't have time to do that or doesn't even bother. They just want to be able to call that one number and have a person who can bail me out on anything that has to do with my health one way or the other. And then all the stuff that's in there that you need to get deployed is in there. I mean, there's health assessment capabilities, so you can figure out in years I'm going to become diabetic and I better start working on my diet. So I can be far more preventative, and I can use alternative stuff, so I can use like more of a natural childbirth than be forced into a hospital where they're going to push me into cesarean potentially, which has side effects and potential problems, but it's lucrative for them to do surgery. So you always got to remember who has a vested interest in this equation, and more often than not, you and a good quality doctor are going to make a lot of different decisions that you're at the mercy of an insurance company or a hospital operation. There's a great episode of The Simpsons where Marge is in the hospital and the doctor comes rushing in to tell her he's all excited because she gets to go home today. And she goes, "Fantastic, am I cured?" He goes, "Well, according to your insurance company, you are."
Gotcha.
So, who's on whose side?
That sums it up, doesn't it?
And then as a simple example to show you how egregious it could become if we let the political climate shift the way it's like trying to do in certain ways. In England, where they have a nationalized healthcare system, it's reached the point where their inefficiencies are so bad and their costs are so upside down that if you come in there with two misperforming eyes as an old person, they test them, and whichever of the two eyes is better than the other, they do some work on that, and then they give you a patch, an eye patch for your other eye.
Wow.
Because they can't even afford to work on two eyes per person, only one.
I mean, that sounds like something that should be happening in a cartoon.
Yeah, I know, it's ridiculous, but that just goes to show when everybody's talking Medicare for all or whatever. I mean, that's kind of where you end up.
Right. Wow. Well, Jeff, you really did. We did about a 40-minute interview last year on the subject where you went even more in depth on not only the details of this program, but also on like the history of health insurance and how we even got into this mess in the first place. So I definitely want to send people to that. That's episode 378 of Lions of Liberty from about this time last year. You can find that at lionsofliberty.com/378. But before we sign off here, I want to take just a couple questions from listeners. Right before we did the show, I just tossed out, hey, if anyone has any questions about this program. So maybe we can just address a couple more questions before we let you go. And
sure.
Colin wants to know, is this beneficial for a new family? And you addressed this a little bit. Is this beneficial for a new family? Someone that's maybe just starting out and having a child. Obviously, there's a lot of things to think about there in terms of pregnancy, having the child, and all of that stuff. Or is it more aimed at singles? And then he also has a kind of a follow-up question. Are there any uses for small business owners with, say, only a couple of employees? Is this something that could help them too?
Oh, appreciate it. Those are both great questions. I forgot to even talk about. Yeah, no, it's the younger you are, the better it is in terms of like anything in terms of becoming involved. Your prices are lower. Your chances of needing, any of the severe side of it is lower. So you're going to have a lot less chance of being exposed to much out of pocket costs. So you can really focus on building your family and your retirement monies and so on. And then for small business owners, it's similarly really good because, again, a lot of them are just one person or maybe 2 to 3 or 5. There's a lot of those types of companies in America, 10. And we're actually able in those little mini groups to do what's called a list bill. So normally if you're running a group, I would just have a very complicated process as a business owner where my health, my admin department or my bookkeeper would be involved in that, and it's a bit of a nuisance, let's say. And small business owners don't have time for that. So what we can do is we can have everybody acquired on an individualized way, but yet we send the business owner one single bill. So they can do it once a month like they're just paying the electric bill for the month. It's a real quick process, and that really simplifies it and allows them to actually finally offer something. Because what we've historically found in 50 or less, which is kind of our sweet spot, 50 employees or less, but very much in that under 20, they typically never offer any health coverage whatsoever to the employees. They're totally on their own. So this gives them a chance to finally have something that they can put in there and look good and feel good and actually truly help those people.
Gotcha. Justin wants to know, and I think I know the answer to this, but it's good to ask because you never know what might change. Do you guys do anything for dental, or is there any kind of dental program, or is this purely the health stuff that's with no relation to dental stuff?
Well, it doesn't have anything related to dental. And I tell everybody, if you look at the real world, there's health insurance and then there's dental insurance. So it's automatically two separate categories out there, just the way the whole world is separated out. And even if we think about going to your normal doctors, they're giving you referrals to the ophthalmologist and to the ear doc. No one ever gives you a referral to the dentist.
Right.
Because they definitely don't work in that same world. But not to discount it, because it's an extremely important part of your health. In fact, it's probably one of the most important parts of your health. The mouth-body connection is highly underrated, and there's a lot of expertise on that out there now in understanding how your body functions. So what we've done is we've built in two ways for you to be able to pay for that stuff in a much more intelligent and much more cost-efficient way. One of the versions of Health Excellence Plus is HSA compatible, which means it's a health savings account, which allows you to accrue money in an IRS approved account that you can use as a tax write-off and pay for all those dental services with that. So that's a way to really get access to that. Or we also have a medical benefits savings account, and that allows you to build up funds in a tax-free way too. That's going to give you probably pretty close to 50 cents on the dollar. So for about half price, I would be able to get my dental work done. So if I go in and negotiate a special cash price, and again, rather than try to use insurance, because the problem with normal health insurance, if I have let's say it's even $1,000 a month premium with my Blue Cross, but I have $1 million bill. Well, all they have to do is pay like my deductible, and then they're going to pay the rest. But if I have dental insurance, it's normally a cap of no more than $1,000 in services on a year. I got to wait 6 months before I can get a cavity filled. So it's a little more of a gimmick the way that product is set up. So you're better off to just go in and pay cash and get a legitimate price from that dentist. And a lot of people pay cash, so they're equipped to give you a cash price.
Right.
And so let's say it works down to $300, and I've run it through this medical benefits account. But that meant I'm spending $150 for that $300 procedure. So dental is important, and we've definitely built in a mechanism to make that a part of this.
Great. And finally, Tori wants to know, what about people who are currently followed by specialists where there's a lot of medical history? How do those costs get factored in? Obviously, we're really talking about pre-existing conditions at this point, which I know you guys do have to treat a little bit differently than someone coming in fresh and totally healthy.
Right, exactly. And that is one of the caveats I was kind of alluding to before, is that, for the type of person this is most suitable for, if they've got a lot of health issues, this may not be appropriate, because for sure in the very first year of involvement with us, we will not share in the cost of anything that's considered a pre-existing condition that was in place for the last 36 months. So somebody that says, look, I just got over cancer like a year and a half ago, that's too soon. They need to have recovered and in full remission for, at least a good 2-3 years type of thing, because starting year 2 is a little limited what we'll do, but, we start to spend money. But it's that first year that's mission critical. So we tell everybody that's thinking about considering this, you really have to understand your health situation. Now, if they're like type 1 diabetic or type 2, or they got cholesterol or whatever, that won't matter. That type of person is typically not that kind of a point where that first year is going to really nothing's going to really occur with them. They may persist on some medication that they've been on, but that's about it. Their status is pretty stable. But somebody says, oh no, I've had remissions and I might have to have a relapse, or I know I'm going to have to go back for surgery in a year from now, then forget it. This is definitely not going to be for that person.
Sure. Gotcha. Well, as always, Jeff, I definitely appreciate your honesty. As we mentioned, towards the top of the show, this is not going to be for everybody. And there's no reason to waste the time of the people that it's not for. We really want to focus on letting people know what this program is about, and, finding people that it truly will be able to help, which is still, I would say a large majority of people that are seeking to, figure out their healthcare needs. So, Jeff, before I let you go, obviously I'll give you a chance to plug everything, but I do want to point listeners to the URL where they can find more information about this on the Lions of Liberty website. That URL is the very simple to remember, lionsofliberty.com/health. So if you just head there, I'll post this interview there. I'll post all the links that you need to go find everything else out. But Jeff, I also post your phone number there. I know you give out your personal phone number. You're happy to answer anybody's questions at all on this matter, and how Health Excellence Plus can help them. So feel free to plug away on anything else that I forgot to mention, and toss that phone number out.
Okay, well, I appreciate you saying that, and and you're one of the few places I'm willing to give my phone number out because the type of people that listen to your show are actually a lot of fun to talk to.
Yeah, you don't get the creepers that you might
not
get.
even that, or people with all the silly, kind of dopey questions and what have you. I mean, you have insightful people.
We got a pretty smart bunch, I like to think.
Yeah, I mean, not to toot their horn, but frankly, that's what I've discovered having been doing this all these years with you. So, in that instance, I would say, look beyond looking at any of the information, because usually you've got some pretty concise questions that are pertinent to you, and rather than jerk around and sift through the website and all what have you, if you want to kind of cut to the chase and call me up, let's go through it and we'll figure out pretty quick if it's up for you or not, and then you can go dig through the information and learn a little bit more and decide to enroll. One thing I would tell you is that the cutoff, we are available year-round, so although he said that it's open enrollment, we are actually a year-round program.
Right, that's not your open enrollment, that's just...
Yeah, that's the government's one, and It's also insurance companies tied in, and they limit you to buying insurance for like 6 weeks out of the entire year. We're year-round, so if you just now listen to this interview 3 months from today and go, oh my gosh, I wish I had heard about this way back when, I wouldn't have bought that, you can ditch that program and come over to this one. Our cutoff is the 20th of every month. So if I wanted to be effective December 1 right now, and today's November 8th, I'd have to sign up by November 20th, and December 1, I have this program. So it's a nice universal thing. We're open and we receive a lot of referrals and recommendations from people about their friends and business acquaintances. We also have a lot of doctors that are promoting us to their patients because we're a great match up to the way they're trying to operate their practice, especially the doctors that are on a cash basis, like an everyday doctor that's a DPC, direct primary care physician. So it's the market has been expanding so much since we started, Mark. It's just very encouraging to see that we're starting to win that war.
Awesome. Did you give out the number?
Oh, I'm sorry. I meant to give it out. I got off on a tangent. I apologize. It's 440-283-6849.
I was like, that was a good rant, but I don't think I heard the number there.
Yeah, let me shout it out again. It's 440-283-6849.
All right, friends, and I can personally attest, Jeff is a great guy. We talked for like an hour before the show today. He's very upfront. He will tell you the truth. All you have to do is ask the questions, and you'll get the answers. So don't be afraid to reach out. And again, for more information, outside of just talking to Jeff directly, head over to lionsofliberty.com/health. Thanks for tuning in, kitty cats. Have a great weekend.